we are going to present the results of the Phase II trial testing Privosegtor in patients with acute optic neuritis. The trial has been conducted in 5 centers in France. It was a randomized, double-blind, placebo treatment. Patients were treated for 5 days IV as an add-on to standard of care, which is methylprednisolone, meaning 1 hour infusion of methylprednisolone followed by 2 hours infusion of Privosegtor or the placebo. Then we follow patients for 6 months with OCT, with visual acuity, with biomarkers, neurofilaments, and results are showing that in comparison with placebo, patients treated with Privosegtor have a significant recovery of vision, which is the most important thing, meaning the low contrast visual acuity, which is the one that is primarily impaired, by more than 3 lines, 18 letters. And this was sustained from month 3 to month 6, which is 3 letters, 15 letters is the cutoff that FDA requires to determine that is clinically relevant. In addition to the high benefits in vision, at the OCT level, meaning in terms of retina atrophy, we found that the patients treated with Privosegtor have a significant protection, meaning reduction in the thinning of the retinal ganglion cell layer and the RNFL layer, which are indicators of neuroaxonal protection by the treatment. In terms of safety was great, meaning no serious adverse events, no adverse event that lead to the withdrawal, meaning in this was excellent. Also, we did a subgroup analysis based on the presence of MS at baseline or not, or the severity of presentation in terms of high contrast visual acuity, 60 letters. And again, the benefits in the clinical outcome, the vision was maintained. And finally, very exciting, the rolling biomarkers. Neurofilaments is a biomarker of axonal damage. And in patients treated with placebo, they have a significant increase and then decrease a little bit, but remain high. And in patients treated with Privosegtor, they have a very, very tiny increase and remain very low for the beginning, which again support this role in protecting axons and having this neuroprotective activity. Therefore, meaning safety was very good. We have evidence of clinical efficacy and efficacy at the biomarker and anatomical level, which means that Privosegtor now is becoming a highly promising therapy for treating optic neuritis and other relapses of MS and even other diseases in which axons have been damaged in brain diseases. We are very excited and we are moving to the Phase III trial in optic neuritis, most likely in another Phase III trial in relapses of MS with motor impairment, for example, in order to bring this drug to patients.